You are over 60 years old. You do everything right. You follow the recommended diet. You avoid sugar. You take your medications exactly as prescribed. You walk when you can. You check your blood sugar. And yet, the numbers keep rising. Or worse, they become unpredictable. One day they're acceptable, the next they spike without explanation. And then come the guilt, the frustration, the feeling that your own body is betraying you. But what if I told you the problem isn't a lack of discipline? What if I told you there may be a silent, ignored, underestimated factor that's sabotaging all your effort? A factor so basic it seems too simple to take seriously? Water. Not just drinking water, but how you drink it, when you drink it, how much you drink, and most importantly, how your body at 60, 70, or 80 years old processes that water. The truth is, as we age, the body changes, and these changes aren't just external, they happen at the cellular level. Inside your cells are structures called aquaporins, tiny channels responsible for allowing water to enter. Over time, these channels can become less efficient, less responsive, less sensitive. That means you may be drinking water, but your cells aren't receiving it in the ideal way. And when cells become dehydrated, something very important happens. They start functioning poorly, and that includes how they respond to insulin. Insulin is the hormone that allows glucose to enter cells. When a cell is inflamed, stressed, or dehydrated, that response can be impaired. The result? Glucose stays in the bloodstream. Insulin resistance increases. The numbers rise. And you think the problem is just food. But there's another, even more concerning detail. As we age, the sensation of thirst decreases. The mechanism that triggers the thirst alarm becomes weaker. You may be mildly dehydrated and simply not notice it. This is extremely common in people over 60. You don't feel thirsty, so you don't drink water, or you drink only when you remember, or you believe you're hydrating with coffee, tea, or juice. And here's another crucial point. Coffee and tea, although they contain water, have a diuretic effect in many people. That means they can stimulate fluid loss. This doesn't mean you can never drink them, but relying on them as your main source of hydration may not be enough. Juices, even natural ones, can raise blood sugar quickly, especially when consumed in large amounts or without fiber. So you think you're doing something healthy, while your glucose levels remain unstable. Another often overlooked factor is medication. Many older adults use diuretics for blood pressure. Others take drugs that increase glucose excretion through urine. Some use combinations for heart, kidney, and metabolic control. These medications are important and save lives, but they can also affect fluid balance. If the body loses more fluid than it receives and replacement isn't adequate, mild chronic dehydration can develop. Not the severe dehydration that causes immediate dizziness, something quieter, more subtle, more prolonged, and chronic dehydration can affect circulation, kidney function, blood pressure, and insulin sensitivity. In addition, as we age, the kidneys gradually lose some of their ability to concentrate urine and retain water. This means the body may lose fluids more easily. Now think, less thirst, lower water retention, medications that increase fluid loss, cells less responsive to water entry, and high blood sugar. It's a scenario that makes sense when analyzed together, but there's more. How you drink water can influence your physiological response. Drinking large volumes at once after long periods without fluids may not be ideal. Smaller amounts spread throughout the day tend to promote better absorption and less kidney strain. Temperature can also affect comfort. Some people tolerate room temperature water better, especially in the morning, avoiding discomfort. And then there are electrolytes. Water doesn't work alone in the body. It depends on balance with sodium, potassium, magnesium, and other minerals. In people who sweat little, consume little salt, or take certain medications, imbalances may interfere with proper fluid retention. This doesn't mean everyone should supplement electrolytes indiscriminately, but it shows that hydration isn't just amount of water. It's context, it's quality, it's timing, it's personalization. Many patients report that simply adjusting their hydration routine, gradually increasing intake throughout the day, watching urine color, reducing dependence on sugary drinks, and paying attention to mineral balance led to better blood sugar stability. This doesn't replace medical treatment. It doesn't replace medication. It doesn't replace proper diet, but it can enhance all of it. High blood sugar rarely has a single cause. It's the result of multiple interacting factors: lack of sleep, chronic stress, inflammation, sedentary lifestyle, poor diet, medication use, hormonal changes, and yes, inadequate hydration. When the body is mildly dehydrated, blood volume can change. This may affect glucose concentration. It can impact kidney function, which filters glucose and other substances. Dehydration can also activate hormones like vasopressin, which has been studied in relation to metabolism and metabolic disease risk. None of this means drinking water cures diabetes. That would oversimplify a complex problem. But ignoring hydration as part of metabolic health is also a mistake. Another common habit is waiting until you feel thirsty to drink. But as mentioned, thirst in older adults may be delayed. When you feel thirsty, you may already be dehydrated. A simple strategy is to create routines: a glass upon waking, another mid-morning, one before lunch, one mid-afternoon, one in the early evening, adjusted according to medical guidance, especially for those with heart or kidney conditions. Observing urine color can also help. Very dark urine may indicate dehydration. Constantly clear urine may indicate excess. Balance is key. Individual conditions matter too. People with heart failure or kidney disease need specific medical guidance about fluid intake. Never increase fluids drastically without consulting your doctor if you have these conditions. The goal here isn't fear, it's awareness. You may be doing everything right with your diet, taking your medications correctly, walking daily. But if you neglect something as basic as proper hydration, you may be limiting the effectiveness of everything else. The human body is an integrated system. Nothing works in isolation. Blood sugar isn't just sugar in the blood. It reflects hormonal, cellular, kidney, liver, and behavioral interactions. When you understand this, you stop blaming yourself and start seeing the full picture. If your glucose remains unstable despite discipline, it's worth discussing hydration, kidney function, electrolytes, medications, and daily habits with your doctor. It's worth evaluating whether you're drinking enough fluids. It's worth checking if you rely too much on coffee and tea. It's worth reducing sugary drinks. It's worth distributing intake throughout the day. It's worth paying attention to your body's signals. Because what seems like a big mystery often has simple contributing factors working quietly in the background. After 60, your body deserves extra attention, not because it's failing, but because it's in a new physiological phase. With proper information, medical follow-up, and conscious adjustments, it's possible to improve glucose stability and quality of life. This isn't about abandoning treatment. It's about making it more effective. It's not about distrusting everything. It's about expanding your perspective. Water may not be the only solution, but it may be a forgotten piece of the puzzle. And sometimes, when the right piece is placed in the right spot, everything starts to make sense. If you suspect you've been underestimating hydration, start with small, safe changes. Observe how your body responds. Track your glucose. Talk to your doctor. Adjust individually. Health after 60 isn't about perfection. It's about understanding, balance, integration. And maybe by paying more attention to something as simple as water, you'll realize you are fighting the wrong enemy. Take care of yourself. Observe yourself. Question. Adjust. Your body is still capable of responding positively when it receives the right environment to function. And sometimes that environment begins with something as simple as a glass of water at the right time.